long-term follow-up programme has been providing tailored and multidisciplinary care to childhood cancer survivors across Victoria for over a decade now. Patients are usually referred to us 2 to 3 years for completion of treatment, and we provide care and support for their health and well-being needs as a result of late effects from their cancer diagnosis and treatment. So as you can imagine, the programme has evolved and changed a lot over the 10 years since it began, and we've actually just recently accepted patient number 2,000, so that is very exciting. But obviously we felt there was need for a review and to really understand how the programme works and what the patients and families experience when they come to see us. The review commenced in April 2020 and had lots of different elements to it, but essentially we did a lot of internal service activity and demand mapping. We spoke with a lot of healthcare professionals who interact with the programme. We spoke with patients and their families, and we also had a workshop with GPs and paediatricians, and also got an international perspective from a subject matter expert overseas as well. And essentially we've pulled all this feedback together and analysed it to support the aim of the review, which was to develop recommendations of a best practice model of long-term follow-up care. We wanted patients and families to be as involved in this project as possible, to really help sort of set the direction and to shape and improve the long-term follow-up programme. So we did this in a couple of ways. Initially, we sent out a patient experience survey to families who had attended within the last 2 years, and we received over 100 responses and an absolute wealth of information. So that was really valuable. But we also facilitated a workshop, and that I think it was 9 parents and 1 young person joined us for that, and that was probably the highlight, one of the highlights of the project, which generated a lot of discussion. We had plenty of time, and we talked lots of things through, but also it generated lots of really fantastic ideas. So those were the main components of consumer engagement, but there were also other opportunities to be involved. We had a parent and a couple of young people on our steering committee and working groups, which was fantastic as we sort of worked through developing these recommendations. We also had a couple of opportunities to review some resources that we were developing. So, for example, a video about what to expect when to come to an appointment, and also some visual resources about the programme itself and the pathway into and out of the long-term follow-up programme. So that was really helpful as well. So as we've pulled all this huge wealth of information together, what's become clear is that the long-term follow-up programme is greatly valued by patients and families, and it's a really unique and important service during the survivorship phase of the cancer care continuum. In summary, the review resulted in a total of 37 recommendations for improvement, and across lots of different areas of the programme. What we found was that the current risk stratified multidisciplinary model of care is aligned with best practice for this cohort of patients. So a lot of the recommendations revolve around other areas such as administration of the programme, education, resources, data collection, research, psychosocial care and support, a bit of a focus on transition, and also about exploring opportunities for shared care closer to home. So lots of different areas of work, but all very exciting, and we're looking forward to moving to the next stage. In terms of what's next for the project, we will be disseminating the recommendations report and now moving to the implementation phase. So we'll be spending some time planning exactly how we're going to do this. So there'll be an implementation and an engagement plan, and we need to identify the resources required to actually deliver on these recommendations. There'll be some really, small quick wins and some really large service improvement projects. So lots to get on with, but importantly, we'll continue to monitor and report against our progress. And I think it's a really good point to mention here that we didn't really have a set agenda for this project in terms of the direction that it would take. We really wanted stakeholders, and especially families and parents, to really set the course of the project, and I feel that has been the case. So what we'll continue to do is work alongside patients and families for the long-term follow-up programme in implementing these recommendations and ultimately delivering a best practice model of long-term follow-up care across Victoria.